Hello, so my name is Samantha Carley, and my project is an investigation into the effectiveness of the drug esketamine compared to traditional antidepressant therapies in the use for treating depression. So, to just begin, depression is a mood disorder which causes persistent feelings of sadness. Among other things, it's the main thing I'm going to be focusing on though, and it affects over 264 million people worldwide. It's often measured on the Montgomery-Åsberg Depression Rating Scale, also known as MADRS, and the higher the score on this scale, the more severe the depression. So therefore, a decrease in score would be a positive thing. And this new drug esketamine was just approved in 2019 by the FDA for use in depression. It's the S enantiomer of ketamine. It's an intranasal delivery, which is definitely different than the traditional methods, and it's also very fast acting compared to them. So the point of my study was to first just examine esketamine in general and compare how it works to the other ones, the mechanisms, etc. And then I wanted to determine if it's more or less effective than the traditional treatments and if the side effects are better or worse. So my hypothesis is that if I compare esketamine to the traditional antidepressants, it'll prove to have the more desirable result and be both more efficacious and efficient in the treatment of depression compared to those traditional drugs. So to do this, I first had to collect a variety of studies, all from online, just examining the use of esketamine in depression. And I assessed the quality of these on the Haddad scale, which is just a scale out of 5 that kind of just looks at the randomization, the blindness, and the follow-up with the participants. I then conducted a meta-analysis using the Cochrane Review Manager, and I was able to determine whether it's more or less effective of a treatment. So before I get into the data, I just would like to make a couple points. So I included 6 studies in total. That was kind of all I was able to find with the data I was looking for. And they all scored 5 out of 5, which is a good score on the Haddad scale. And just to note, the placebo group is the one that contains the traditional antidepressant, so that's our control. The reason they did this is because it would be unethical to remove the patients from treatment since they were all getting treated before. So when I mentioned placebo, that's what I'm referring to. So in figure 1, I was just looking at the effectiveness of esketamine, and each line here represents a study. The square is the average of those studies, and the diamond at the bottom is the average of all the studies together. And the bigger the square, the more significance that study had. Basically, there's more participants. So the first one measures the least square mean change in MADRS scores from baseline to the end of the study. And this just shows how effective it was. So as we can see here, it does favor the esketamine side. It falls in the more negative values, which means that there was a greater decrease in the esketamine scores, which means there's less depression overall. So I can determine that it works better. Next is just the overall adverse events. So that's just anything that happens that's undesirable. And I found here that the placebo is favored in this case for having less overall adverse events. As we can see, it's lower here on the scale, which means less participants had adverse events in the placebo group. And then I just wanted to look at 2 specific events of dissociation and severe sedation. And in both of these cases, esketamine was favored to have more of these that occurred. That does make sense as well, just because those are common side effects with esketamine, but we definitely did see it more since, as we can see, it's on a higher number and favored on the esketamine side for both of these instances. So overall, to conclude, my meta-analysis does support the hypothesis that esketamine is a more effective treatment option than the traditional options. So I did accept my hypothesis. I also think it's important to note the method of administration. It's easier to do an intranasal administration, and as well, it's directly absorbed through the lungs, which does contribute to the rapid onset, but also the mechanism of action contributes as well. It's different than the other ones. And then a few things I want to look into are the abuse potential. Since ketamine can be abused, we don't know if it's ketamine can be yet. And then I would like to see some more long-term studies which just don't exist because it hasn't been around very long. So eventually, when those do come out, I would like to look at those as well. And I also would like to see the more specific timing of when it actually starts working, just because I wasn't able to fulfill the second part of my hypothesis to determine the exact efficiency. I just wasn't able to find enough data for that. So I just wanted to thank my supervisor, Dr. Sam Bardell, and then the courts coordinators for setting this up, and the Cochrane Review Manager in aiding my research. That's all. Thank you.